On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Richard Ha, Dr. Jonathan O, Dr. Peter Baek, Dr. Clayton Frenzel.
Hello again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center.
This is a whole show dedicated to Forest Park Medical Centers and its amazing physicians.
Forest Park Medical Center, of course, one of the top medical centers in the entire Dallas-Fort Worth area, and we have a great show for you today.
We certainly do. Let's start off with our first Forest Park physician, plastic surgeon Dr. Richard Ha.
The prevalence of skin cancer is only increasing, especially since we live in Texas, in a southern state. Just the amount of sunlight exposure is greater than, say, if you lived up north. And those who are susceptible can get skin cancers. The most common ones are generally less aggressive. They're called basal cell cancers. You have some more aggressive subtypes such as squamous cell, and then the deadly killer, which is melanoma. Unfortunately, that's more rare.
Back in 2008, I had a little spot that was biopsied and came back positive as basal cell carcinoma. When I met Dr. Ha, he said that he would have to do a skin graft using a piece of tissue from my ear. That surgical procedure worked out really well. Scary at first, but it turned out really well. This year, in May, there was another spot on my nose.
In Dottie's case, she had a skin cancer on the tip of her nose, which is a very challenging location because there's not an easy way to just bring the edges of the defect together without creating a lot of distortion. So you're left with some of the other options. Well, skin graft on her was not a great option because of the depth of it. It was going to heal with a divot, something that had been very noticeable. So really we're left with the more complex option of doing a nasolabial flap, or borrowing tissue from the cheek, leaving it tethered to the cheek, and then attaching it to the nose. Dottie had that procedure done, and that trunk was left there for 4 weeks. She was a great patient. She hung in there. We went to that second stage. We divided it. I did some dermabrasion to kind of sand and smooth the edges of the scars, and she's only a few months out, and it's very hard to even tell that she had anything done.
Dr. Ha is just amazing. He's like an angel. He makes you feel comfortable. He held my hand and he said, "Don't worry, Dottie, you'll look great." And I just had to trust in him. When I think about everything that I've been through, I'm very happy, very happy. I still recognize my nose and I think it looks great. Healthy nose, yes. Cancer-free, yes. I'm very pleased.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside and what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically 3 compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
Did you know that Forest Park Medical Center was voted as one of the top 100 places to work in the Dallas-Fort Worth area? Forest Park Medical Center received this honor for the second year in a row.
Endometriosis is glandular cells similar to the lining of the uterus that gets where it doesn't belong. It can get on the bowel, the bladder, the uterus, the tubes, the ovaries, in their liver, in their lungs. This is a disease that can get almost anywhere, and it's not a malignancy, it's not cancer, but the symptoms that it produces are so life-interfering that it feels like a life-threatening problem. They can't function. And it grows with hormones. And all of this is related to their immune system. Women are more likely to have lupus, rheumatoid arthritis, hypothyroidism. They have problems with their bladder where they pee a lot during the day and there's blood in the urine. So because of the immune system, this disease continues to grow. They can't eradicate it, they can't get rid of it. And it does grow with their own hormones or even artificial hormones such as birth control pills. How do I know when to go to the doctor? If your symptoms are interfering with your normal functions, that's the time to go see a doctor. If you wake up in the morning with your cycle and it hurts a little bit, you don't even have to take any medication, maybe you don't need to see a doctor. If you have to take any pain medication, if you have to lay on a heating pad, if you can't go and have fun with your friends or your family and do your normal activities, that's the time to seek help from somebody who deals with endometriosis on a daily basis. The way to cure and get rid of as much endometriosis as you can is actually to cut it out. We outline it and then lift the tissue up and then cut underneath so that we have normal tissue that we take out along with the endometriosis. So by doing this, we eradicate as much endometriosis as we possibly can. Any place where this disease is at, we have to excise it / cut it out so that we give that patient the best opportunity to be as symptom or disease-free as we can. The goal of this is to treat this disease early. If we can treat this disease early, we have a much better success rate in eradicating this disease so that a woman could go on and have a very functional life. And early treatment is key to this.
Up next, we'll meet Dr. Peter Baek, who has an innovative, non-invasive way to help individuals suffering from neck pain.
PSTIM is a lightweight device that's worn behind the ear and that sends electrical impulses to the ear, which help to reduce pain by causing the body to release its natural endorphins.
Well, I've had a bulging disc for a number of years, which has caused burning pain in my neck and upper back and shoulders. It's the type of thing that I, over the years, learned to simply accept because the only alternative was surgery, and I'm not yet ready to go that way.
Mike is a patient whom I've treated for neck pain. What he told me is that he has a bulging disc, which at this point does not require surgery. However, the pain in his neck prevents him from doing many things.
I wear it for 4 days, off for 3, wear it for 4 days, off for 2 weeks. Hopefully, if I need it again, it might be a month or 2 between treatments. Eventually, you'll get to where you don't need it at all. With me, the time without it is expanding.
This is the portion of the device that's worn behind the ear. The wires lead to the electrodes, which are right here, which are placed on the ear itself.
After years and years of chronic pain, Dr. Baek put this on one morning, and literally within 2 minutes, I felt a sense of relaxation washing over me. And within an hour, I started feeling more range of motion, and the pain now is such that I many times don't even notice it.
This is such a new technique to me. Every patient for whom I put this on, the first thing that people would state to me is that they have slept like they had never slept before.
Well, I think the biggest change that I've experienced is having more restful sleep. The PSTIM doesn't repair anything. If you have, in my case, a bulging disc or other problems, it's not going to repair that. It's going to make the pain more manageable. And the most attractive thing about the PSTIM for me was that if it doesn't work, the alternatives still exist. I've lost nothing by trying this. And in my case, it's been an amazing discovery.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and, you know, he'd say, Daddy's sick, and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
As always, for more information on any of the doctors you've seen on today's show, just go to our website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
Right, and Forest Park Medical Center and their fine physicians are dedicated in helping change people's lives, like our next Forest Park Medical Center doctor, Jonathan O. When it comes to developing gynecologic cancer, Dr. Jonathan O has a few reasons how it develops.
For most gynecologic cancers, they're what we term sporadic, meaning that there's no familial disposition, there's no genetic link. So about 85% will just be sporadic, but the small percentage will be hereditary.
When dealing with gynecologic cancer, there are signs and symptoms to watch for that are associated with the three most common cancers. First, ovarian cancer.
For ovarian cancer, the signs and symptoms are very generalized. And when I say generalized, what I mean is that the symptoms are not specific to what you would think would be gynecologic cancer. So the most common complaint that women will have for ovarian cancer is bloating and distension. So it's not pain, it's not any problems with what they feel like is their female organs, but it's just feeling bloated. Oftentimes people come in saying that they just can't eat as much, they feel full really early, they feel like their bellies are getting bloated and their clothes are fitting more tightly. And these are problems that just persist and progress over time.
Another form of gynecologic cancer is uterine cancer, which is common among both older and younger women.
The most common sign for uterine cancer is postmenopausal bleeding. So if a woman generally over 50 who's done having periods starts to have any bleeding, then she should seek medical attention because that's a very, very worrisome sign. And that's the most common sign for uterine cancer. The most common sign for uterine cancer in a young patient would be heavy vaginal bleeding. So if you have bleeding that's much heavier than your typical period and this persists over several weeks to several months, then that warrants an evaluation and biopsy.
Now to the third common gynecologic cancer, which is cervical cancer.
The most common symptom for cervical cancer is abnormal bleeding. And oftentimes this will present as what we call postcoital spotting. And postcoital spotting is just a fancy term for spotting or abnormal bleeding after intercourse. What will happen is that the cancer will develop on the cervix with what we call trauma, and trauma could be intercourse. It stirs the cancer up and causes it to bleed, and women will present complaining of bleeding.
If you are having any of these signs and symptoms, please consult your physician. Today's Ask the Doctor comes from Mary. Mary has a question for Dr. Lowell Ku. My husband and I are trying to get pregnant. When is it time to seek a fertility specialist?
Many couples may wonder, well, after how long should I be worried that maybe something's wrong, and when should I see a doctor? Well, the true definition of infertility is when a couple has been actively trying for over a year without success, as long as they're under 35 years of age. If they're over 35 years of age and they've been trying for 6 months or greater, then they should seek help, and they would be considered to have infertility. So if you are under 35 and you've been trying for over 1 year, or if you're over 35 and you've been trying for over 6 months, it's time to seek help.
Well, I woke up one day in early July, about 3 years ago, and had a small lump on my neck that I thought was an ingrown hair or something like that. But it continued to get bigger and bigger over the next several weeks. And that prompted me to see my regular doctor, so I ended up seeing an ENT, which he ran some tests. A week later, he diagnosed the cancer. I decided I need a second opinion, and I ended up in Dr. Andy Chung's office.
We sat down, I kind of discussed with him what I believe was going on. He had already had a needle biopsy of the neck mass, which confirmed that it was a metastatic malignancy called a squamous cell carcinoma. And he asked me what options he had aside from getting radiation and chemotherapy, which he was very concerned about.
Hearing the word cancer is something you only think happens on TV or to someone in the paper, but when it happens to you, it is pretty scary.
I talked to him about a minimally invasive surgical option where I described how we could go in and remove the cancer in the back of his tongue, literally with no incisions.
The tumor on my tongue was fairly large, and when I saw a picture of it, it looked like a great big mushroom cap way back in the back.
You can see this is the lymph node on the left neck that Mr. McNeff noticed. After surgery, we repeated this scan, and what you see now is that this bright orange mass that was in the back of his tongue is no longer there. So you can see that that tumor is completely gone based on the PET CT.
It seemed like I recovered pretty much from the surgery in a matter of days. The worst part of this whole procedure was the radiation treatment.
Our goal is to preserve speech, respiration, and swallowing. And I think because of that and that preservation, patients are recovering quicker, and the potential complications are significantly reduced.
Before I went to go see Dr. Roshek, I actually had seen my family doctor because I had some pains down the growing area. It was severe pain. It hurt to walk. It hurt to do basically just anything, really. And it became too severe for me to handle.
Groin hernias either can be one-sided or both-sided. Typically, if a patient has a one-sided groin hernia, I recommend the open hernia repair for that patient. I make an incision in the groin, we fix the hernia, and we'll typically use a piece of mesh to repair the hernia. If the patient has a dual-sided groin hernia, I find that the laparoscopic technique is more beneficial because we can make this small incisions that we use for the laparoscopic technique and fix both hernias at the same time. We found that the laparoscopic technique and the open technique are very similar in regards to durability of the repair and recurrence. However, we've seen that the laparoscopic technique allows patients to go back to work sooner, and a lot of times we'll have less pain in the postoperative period.
When I went to see Dr. Roshek, he did the full exam again, and at that time he discovered a second hole in my intestinal wall.
So in Anthony's case, he was starting to feel growing pain, and he thought it was just on one side, but it turns out that when I saw him in the office, he actually had a hernia on both sides. And this hernia was really making it hard for him to do what he loves, which is mainly he likes to hike. And when he's hiking, he participates in geocaching, where basically you're on a glorified treasure hunt. So it was really holding him back from that. He was noting a lot of pain when he was trying to go hiking and enjoy his life. Once the hernias were diagnosed, we settled on the laparoscopic technique to fix both sides at once.
After the surgery, it was 3 or 4 days. The surgery was on Wednesday. Not being one who likes to be cooped up, a very active kind of guy, I like to be able to get out. From then, it was a little bit more at a time. By Monday, I was back at work.
And since surgery, he's been doing great, and he's out there hiking and geocaching all the time now.
Dr. Roshek, as a doctor, he was extremely welcoming. He's extremely friendly, extremely open, a very good person.
Time for our next Forest Park doctor. It is Dr. Clayton Frenzel, who explains how revisional bariatric surgery can help those that have had unsuccessful surgery in the past.
First of all, from a bariatric perspective, the procedures that I offer my patients are the gastric band, the gastric sleeve, the gastric bypass, and revisional surgery.
I had the lap band done in 2008, and everything was going pretty good for maybe the first year and a half. In 2010 is when it got really, really bad, where I couldn't hold much food down.
When a patient comes to me with these complaints, I usually recommend that we go ahead and convert them to another operation. And the most common operation I will convert them to is either the gastric sleeve or the gastric bypass after the band has been removed.
Dr. Frenzel's commercial had popped up maybe a week or two prior, so I headed to the website, looked him up. He was available for an appointment right away.
One of the issues that could come up if you try to convert the patient from the band to the sleeve is you're exchanging one restrictive procedure for another restrictive procedure and not adding a whole other component of weight loss.
We discussed the various different procedures that could be performed, and we decided on a gastric bypass, and that's what he performed on me to remove the band.
The patients just need to be educated very thoroughly about the options. The gastric bypass, in my opinion, the weight loss is probably going to be a little bit quicker, and at the end of a year and at the end of 5 years, I think the results will still be better than the conversion to the gastric sleeve. The patients still have to do their part. No surgery is going to do 100%. They still have to do their 40 or 50% to help get the weight off, meaning they're going to have to eat healthy, they're going to have to see the nutritionist, they're going to have to come see me in follow-up, they're going to have to exercise. It's a whole spectrum of things that have to come together. It's like a puzzle. All the pieces have to come together to be successful. The surgery is one piece of that puzzle.
I just feel now that I'm ready to climb Mount Everest, run my first marathon. I know all of this is possible prior to this procedure that was performed on me. I was really just trying to exist. I know my family needed me, and I know I needed to work to maintain the things that you have to have in life.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
The Da Vinci robot has been used extensively in gynecology since about 2008, and it allows us to do major surgery on patients that used to would facilitate a large incision, but now we're able to do these through smaller, minimally invasive incisions, allowing the patient quicker recovery and quicker return to our normal activities.
I work a full-time job. I perform on the weekends. I'm a jazz blues singer. The recovery time seemed to me to be a little bit more because of the weight issue. But the robotic procedure kind of lessens that fear.
Wanda was having a lot of pressure down below, and she stated that she felt like things were changing inside of her. She knew she had the fibroids, but she felt like they might be growing again. We did a sonogram. It showed that her uterus and fibroids collectively were about the size of a volleyball, and definitely could be causing the pressure and the abdominal pain that she was experiencing. It's kind of like a muscle cramp in the uterus. And unlike muscle cramps in our other muscles, these muscle cramps don't go away, they stay.
He explained the process to me. And I said, this is the person who's going to do the surgery. And there's another procedure, but the procedure was done. And within less than 2 weeks, I did a performance. I was very pleased with the outcome.
Well, we did her surgery in mid-afternoon or so. And I saw her that night, and she says, I really could go home right now, but I think I'll just stay. So we kept her overnight. The next morning, she felt great. She was ready to get out of there. I saw her back about 2 weeks later, and she had already done her first performance. I think she said it was 10 days from the time she had her surgery to the time she was back on stage.
I know my doctor said, don't do anything, don't drive for at least 3 or 4 days, but I felt good, you know. So, you know, I would recommend this to anyone who is thinking about having this procedure.
That'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, one of the top medical centers in the entire Dallas-Fort Worth area. And the good news, Candace, for the fine folks wanting more information about Forest Park Medical Center and their great doctors, you can head to the website, bestdocsnetwork.com, click on the Forest Park tab.
That's right, with unsurpassed service, exemplary care, and the highest quality medical facility, prepared to have your expectations exceeded.
And if you have a question or comment for us, we'd love to hear from you. Send us an email, info@bestdocsnetwork.com.
That's right, we'll see you next week.